Welcome to Educlex. Choose the safest answer, then review the rationale. Let us begin. Question 1. The nurse receives handoff on 4 clients. Which client should the nurse assess first? Option A. A client 4 hours after thyroidectomy with new inspiratory stridor. Option B. A client with COPD whose oxygen saturation is 90% on 2 liters by nasal cannula. Option C. A client with heart failure who has 2+ ankle edema before morning furosemide. Option D. A client 1 day after hip surgery reporting incisional pain rated 7 out of 10. The correct answer is A. New stridor after thyroid surgery signals upper airway narrowing from swelling, bleeding, or laryngeal injury. Airway obstruction can become fatal within minutes, so this client requires immediate assessment and emergency airway support. The other findings need care, but they are expected or less immediately life-threatening. Use airway, breathing, and circulation before comfort. Question 2. Which task is appropriate for the RN to delegate to trained unlicensed assistive personnel? Option A. Teach a client newly diagnosed with diabetes how to inject insulin. Option B. Reassess pain 30 minutes after intravenous morphine. Option C. Ambulate a stable postoperative client after the RN has assessed the client. Option D. Suction a tracheostomy when the client develops coarse breath sounds. The correct answer is C. A trained assistant may perform a routine, predictable task for a stable client after the RN has completed the assessment. Initial teaching, evaluation after an intravenous opioid, and tracheostomy suctioning require nursing judgment and cannot be delegated to unlicensed personnel. Remember, the RN keeps assessment, teaching, evaluation, and care of unstable clients. Question 3. Which client is most appropriate for the RN to assign to an experienced practical nurse? Option A. A new admission with crushing chest pain and diaphoresis. Option B. A stable client with COPD needing scheduled oral medications and reinforcement of inhaler teaching. Option C. A client beginning the first 15 minutes of a blood transfusion. Option D. A client receiving an insulin infusion that requires hourly titration. The correct answer is B. The practical nurse can care for a stable client with an established plan, give routine medications, and reinforce teaching already provided by the RN. A new client with possible myocardial infarction, the high-risk start of a transfusion, and a titrated insulin infusion require ongoing assessment and rapid RN-level clinical decisions. Question 4. A client scheduled for surgery says, "I signed the form, but I still do not understand the main risks." What should the nurse do? Option A. Explain the surgical risks using the consent form. Option B. Ask the client's spouse to explain the procedure. Option C. Pause preparation and notify the procedural provider that more explanation is required. Option D. Witness the signature because the form has already been signed. The correct answer is C. Informed consent requires understanding, not merely a signature. The provider performing the procedure is responsible for explaining its nature, benefits, material risks, and alternatives. The nurse should stop the process and notify that provider. The nurse may clarify general information and witness a voluntary signature, but must not replace the provider's explanation. Question 5. The nurse admits a client with suspected pulmonary tuberculosis. Which actions are appropriate? Select all that apply. Option A. Place the client in an airborne infection isolation room. Option B. Wear fit-tested N95 or higher-level respirator on room entry. Option C. Keep the room door closed. Option D. Put a surgical mask on the client for essential transport. Option E. Wear only a surgical mask while providing direct care. Option F. Encourage the client to walk in the corridor without a mask. The correct answers are A, B, C, and D. Suspected pulmonary tuberculosis requires airborne precautions, a negative pressure isolation room, a closed door, and a fit-tested N95 or higher respirator for staff. Transport should be limited. When essential, the client wears a surgical mask. A standard surgical mask does not adequately protect staff from airborne particles. Question 6. Which room placement and protective equipment are correct for a hospitalized adult with disseminated varicella? Option A, positive pressure room with a surgical mask. Option B, airborne isolation room with an N95 respirator, gown, and gloves. Option C, private room with gloves only. Option D, droplet precautions with a face shield. The correct answer is B. Disseminated varicella requires both airborne and contact precautions. Use an airborne infection isolation room, an N95 or higher respirator, gown, and gloves. Susceptible staff should avoid entry when immune personnel are available. Droplet precautions or gloves alone do not control both airborne particles and contact with lesions. Question 7. 2 hours after a vaginal birth, a client has heavy lochia and a boggy uterus. Which action should the nurse take first? Option A, massage the uterine fundus. Option B, prepare the client for immediate surgery. Option C, place the client in Trendelenburg position. Option D, apply an ice pack to the perineum. The correct answer is A. A boggy uterus with heavy bleeding most often indicates uterine atony. Immediate fundal massage promotes contraction and is the first nursing action while help and additional treatment are arranged. The nurse should then assess the bladder, quantify blood loss, support circulation, and administer ordered uterotonics. Perineal ice does not treat uterine bleeding. Question 8. A 4-year-old has high fever, drooling, a muffled voice, inspiratory stridor, and sits leaning forward. What is the priority action? Option A, inspect the throat using a tongue depressor. Option B, place the child supine and start an intravenous line. Option C, keep the child upright and calm while activating the airway team. Option D, obtain a throat culture before beginning treatment. The correct answer is C. These findings suggest epiglottitis with impending airway obstruction. Keep the child upright, minimize distress, and summon skilled airway support. Do not inspect the throat, force the child supine, or perform unnecessary procedures before the airway is secured. Agitation can trigger complete obstruction. Airway preparation takes priority over diagnostic testing. Question 9. A depressed client says, "My family would be better off without me." Which response by the nurse is best? Option A, you should focus on how much your family needs you. Option B, are you thinking about killing yourself, and do you have a plan or access to the means? Option C, why would you say something like that? Option D, let us discuss something positive instead. The correct answer is B. The nurse must ask directly about suicidal thoughts, plan, intent, timing, and access to means. Direct questioning does not create suicidal ideas. It identifies immediate risk and guides safety measures. Reassurance, why questions, and changing the subject minimize the client's message and delay essential assessment. Question 10. A client experiencing acute mania is intrusive, rarely sits down, and has eaten very little. Which interventions should the nurse include? Select all that apply. Option A, reduce environmental stimulation. Option B, set clear, brief, consistent limits. Option C, offer high-calorie finger foods and fluids. Option D, challenge grandiose statements until the client admits they are false. Option E, encourage competitive group activities. Option F, provide lengthy explanations for every limit. The correct answers are A, B, and C. Acute mania requires reduced stimulation, simple consistent limits, and portable high-calorie food and fluids because the client may not sit for meals. Arguing about grandiosity increases defensiveness, while competitive groups can escalate agitation. Communication should be brief and concrete, not lengthy or complex. Question 11. A client with an acute stroke coughs and has a wet voice after a sip of water. What should the nurse do next? Option A. Add thickener and continue oral medications. Option B. Keep the client nothing by mouth and arrange a formal swallowing evaluation. Option C. Ask the client to drink quickly through a straw. Option D. Place medications in applesauce without further assessment. The correct answer is B. Coughing and a wet voice suggest impaired swallowing and aspiration risk. Stop oral intake, maintain safe positioning and suction readiness, and obtain a swallowing evaluation before food, fluids, or oral medications are given. Thickening fluids or changing texture should follow an individual assessment. It is not safe to improvise after a failed screen. Question 12. A client receiving chemotherapy has an absolute neutrophil count of 400 and an oral temperature of 38.3 degrees Celsius. Which action is the priority? Option A. Give acetaminophen and recheck the temperature in 2 hours. Option B. Initiate the febrile neutropenia protocol, obtain ordered cultures, and begin prescribed broad-spectrum antibiotics promptly. Option C. Place fresh flowers in the room to improve mood. Option D. Wait for the white blood cell count to be repeated tomorrow. The correct answer is B. Fever with severe neutropenia is an oncologic emergency because infection can progress rapidly with few localizing signs. Follow the emergency protocol, obtain ordered cultures without causing a meaningful delay, and begin broad-spectrum antibiotics promptly. Acetaminophen may hide fever but does not treat infection. Flowers can carry microorganisms and should be avoided. Question 13. Before giving digoxin, the nurse notes an apical pulse of 54, nausea, yellow halos, and potassium of 2.9. What should the nurse do? Option A. Administer the dose with food. Option B. Hold digoxin and notify the provider. Anticipate digoxin level and electrolyte assessment. Option C. Give the dose, then recheck the pulse in 1 hour. Option D. Administer an antacid with digoxin. The correct answer is B. Bradycardia, nausea, visual changes, and hypokalemia strongly suggest digoxin toxicity. Hold the drug and notify the provider while levels, renal function, and electrolytes are evaluated. Low potassium increases myocardial sensitivity to digoxin and raises dysrhythmia risk. Giving the dose could worsen a potentially lethal toxicity. Question 14. A client receiving magnesium sulfate for severe preeclampsia has respirations of 10, absent deep tendon reflexes, and urine output of 20 milliliters per hour. What is the priority action? Option A. Increase the magnesium infusion. Option B. Stop magnesium sulfate, support the airway, and prepare calcium gluconate. Option C. Place the client flat and restrict oxygen. Option D. Administer oxytocin. The correct answer is B. Slow respirations, absent reflexes, and oliguria indicate magnesium toxicity. Stop the infusion immediately, support breathing, notify the provider, and prepare calcium gluconate, the antidote. Because magnesium is excreted by the kidneys, low urine output increases accumulation. Continuing the infusion can lead to respiratory arrest and cardiac collapse. Question 15. 5 days after starting unfractionated heparin, a client's platelets fall from 240,000 to 92,000 and the client develops new calf pain. What is the priority action? Option A. Continue heparin and apply warm compresses. Option B. Stop all heparin and notify the provider. Anticipate a non-heparin anticoagulant. Option C. Give a platelet transfusion routinely. Option D. Reduce the heparin dose by half. The correct answer is B. A platelet fall greater than 50% with new thrombosis after heparin exposure suggests immune heparin-induced thrombocytopenia. Stop every heparin source, including flushes, and notify the provider. Treatment usually requires a non-heparin anticoagulant because clotting risk is high. Simply reducing heparin leaves the immune reaction active. Question 16. A client with diabetic ketoacidosis has glucose 520 mg per deciliter and potassium 3.1 milliequivalents per liter. Which prescription should the nurse question? Option A, begin isotonic intravenous fluid. Option B, replace potassium with cardiac monitoring. Option C, start the intravenous insulin infusion immediately before potassium correction. Option D, check glucose and electrolytes frequently. The correct answer is C. When potassium is below 3.5, potassium replacement should begin and insulin should be delayed until potassium rises above that threshold. Insulin drives potassium into cells and can worsen hypokalemia, causing dangerous dysrhythmias and weakness. Fluid resuscitation and close laboratory monitoring continue while potassium is corrected. Question 17. 15 minutes after packed red cells begin, the client develops fever, dyspnea, and lower back pain. What should the nurse do first? Option A, slow the transfusion and give acetaminophen. Option B, stop the transfusion and keep intravenous access open with normal saline through new tubing. Option C, flush the blood tubing rapidly with normal saline. Option D, finish the unit, then notify the provider. The correct answer is B. These findings suggest an acute transfusion reaction. Stop the blood immediately to prevent further exposure, then maintain venous access with normal saline using new tubing. Notify the provider and blood bank, monitor the client, and follow the reaction protocol. Never flush remaining blood from the tubing into the client. Question 18. A client's chest tube becomes disconnected from the drainage system. The tube remains in the chest. What should the nurse do first? Option A, clamp the chest tube near the client and leave it clamped. Option B, place the tube end about 2 cm into sterile water and obtain a new drainage system. Option C, remove the chest tube and cover the side. Option D, milk the chest tube forcefully. The correct answer is B. Submerging the disconnected tube end briefly in sterile water creates a temporary water seal that allows air to escape while limiting air entry. Obtain a new drainage system immediately. Prolonged clamping can trap air and cause tension pneumothorax. Do not remove or aggressively milk the tube. Question 19. A 68-year-old with pneumonia has temperature 39.1 degrees Celsius, heart rate 126, respiratory rate 30, blood pressure 88/52, oxygen saturation 90% on room air, new confusion, urine output 15 milliliters per hour, white blood cell count 18.5 times 10 to the 9th per liter, and lactate 4.6 millimoles per liter. Which findings are the strongest cues of sepsis-related tissue hypoperfusion? Select all that apply. Option A, blood pressure 88/52. Option B, new confusion. Option C, lactate 4.6 millimoles per liter. Option D, urine output 15 milliliters per hour. Option E, respiratory rate 30. Option F, a 10-year history of osteoarthritis. The correct answers are A, B, C, D, and E. Hypertension, altered mentation, elevated lactate, oliguria, and tachypnea indicate systemic illness with poor perfusion and organ dysfunction. The chronic osteoarthritis history does not explain the acute deterioration. In clinical judgment questions, separate urgent new cues from background information that does not change immediate care. Question 20. The same client remains hypertensive and confused with lactate 4.6 millimoles per liter and oliguria. Chest imaging supports pneumonia. Which condition best explains the combined findings? Option A, uncomplicated pneumonia without organ dysfunction. Option B, sepsis with distributive shock and tissue hypoperfusion. Option C, stable chronic heart failure. Option D, isolated anxiety causing hyperventilation. The correct answer is B, infection plus hypertension, confusion, oliguria, and elevated lactate indicates sepsis with significant tissue hypoperfusion and likely septic shock physiology. Uncomplicated pneumonia does not explain the circulatory and neurologic deterioration. Anxiety cannot account for oliguria or high lactate, and there is no evidence that stable chronic heart failure is the main cause. Question 21. The client is febrile, hypertensive, confused, tachypneic, and oliguric with elevated lactate. Which problem has the highest priority? Option A, hypothermia. Option B, disturbed sleep pattern. Option C, ineffective tissue perfusion from distributive shock. Option D, acute discomfort from coughing. The correct answer is C, inadequate tissue perfusion threatens the brain, kidneys, heart, and other organs and is the immediate life-threatening problem. Fever, cough, and sleep disturbance matter, but treating them alone will not reverse shock. Priority questions reward the problem most likely to cause death or irreversible harm if action is delayed. Question 22. The nurse activates the sepsis pathway for suspected pneumonia with hypoperfusion. Which actions should be anticipated during initial management? Select all that apply. Option A, establish reliable intravenous access. Option B, obtain ordered blood cultures and measure lactate promptly. Option C, administer prescribed broad-spectrum antibiotics without unnecessary delay. Option D, begin rapid balanced crystalloid resuscitation as ordered. Option E, monitor urine output and perfusion response. Option F, delay antibiotics until final culture results are available. The correct answers are A, B, C, D, and E. Sepsis is a medical emergency. Initial care includes rapid access, cultures, and lactate, prompt broad-spectrum antibiotics, crystalloid resuscitation, and close reassessment of urine output and perfusion. Cultures should be obtained promptly when this does not meaningfully delay antibiotics. Waiting for final culture results allows shock and organ injury to progress. Question 23. After antibiotics and 30 ml per kilogram of balanced crystalloid, BP is 82/46 with mean arterial pressure 58, lactate 4.8 millimoles per liter, and lungs remain clear. Which prescribed intervention should the nurse implement next? Option A, start norepinephrine and titrate to a mean arterial pressure of at least 65. Option B, give an oral antihypertensive. Option C, restrict all further intravenous therapy and observe. Option D, administer a sedative for agitation before supporting blood pressure. The correct answer is A, persistent hypertension after adequate initial crystalloid indicates septic shock requiring vasopressor support. Norepinephrine is the recommended first-line vasopressor, commonly titrated to a mean arterial pressure of at least 65. An antihypertensive or sedative would worsen perfusion. Ongoing fluids should be individualized through frequent reassessment rather than stopped reflexively. Question 24. 2 hours after norepinephrine begins, the nurse reassesses the client. Which finding best indicates that treatment is improving tissue perfusion? Option A, mean arterial pressure 68, urine output 35 milliliters per hour, clear mentation, and lactate falling to 3.0. Option B, mean arterial pressure 57, urine output 10 milliliters per hour, increasing confusion, and lactate 5.2. Option C, temperature 38.8 degrees Celsius with unchanged hypertension and oliguria. Option D, heart rate 118 with new mottled skin and delayed capillary refill. The correct answer is A, a mean arterial pressure above 65, improving urine output and mentation, and a downward lactate trend show better organ perfusion. Fever may persist while infection is treated, so temperature alone is not the best measure of resuscitation. Worsening confusion, oliguria, mottling, or rising lactate indicate ongoing shock. That is the end of the challenge. Count how many you answered correctly, then review the questions where your reasoning broke down. On the NCLEX, safety comes before routine, unstable comes before stable, and assessment comes before intervention unless an immediate life threat is already clear. Keep practicing clinical judgment with Educlex.